If you have brain fog, waves of anxiety, or trouble sleeping, and no one can tell you why, and you've been exposed to mold, you're not crazy, and you're not alone. Hi, I'm Dr. Mario Mancini from the Center for Integrative Care here in San Diego. We're now beginning to see more and more mold exposure cases at our clinic. So I wanted to take a moment to share how biomedical acupuncture can play a major role in enhancing the medical care already being provided to these patients. So this video is for anyone who's been affected or anyone supporting a patient or client dealing with this invisible burden of mold-related illnesses. So let's start with some basics. Mold exposure isn't just about sinus issues or musty smells. See, certain mold release mycotoxins, which are really biological poisons. These substances can impair mitochondrial function, trigger neuroinflammation, and disrupt autonomic nervous system function. This is where biomedical acupuncture steps in. Studies have shown that acupuncture stimulates parasympathetic nervous system activity, shifting the body out of chronic fight-flight into a restorative repair response. It's been shown through functional MRI to activate regions like the anterior cingulate cortex and medial prefrontal cortex, which are involved in regulating mood, attention, and stress. See, when the body's stuck in a neuroimmune stress loop, it cannot detox properly. Blood flow is shunted away from the brain and gut, two of the most important systems affected by mold. Within a few acupuncture sessions, patients often report clearer thinking, reduced anxiety, and better sleep. See, mold exposure almost always affects sleep. Whether it's falling asleep, staying asleep, or waking up unrefreshed, your nervous system is stuck in hyper-alert state. So why does sleep matter so much? Listen, sleep is where detox happens. Without it, the brain can't clear toxins and the immune system stays inflamed. What do our patients notice? More vivid dreams, fewer night sweats, and waking up with energy again. Mold exposure always affects how people feel and how they cope. Depression, panic attacks, emotional reactivity, even personality shifts can occur. Biomedical acupuncture helps rebalance those neurotransmitters like serotonin and dopamine while modulating cytokines involved in neuroinflammation. See, inflammation from mold can literally change how your brain functions. Patients often say things like, "I feel like myself again." That's neuroimmune physiology speaking. Also important to note, many patients dealing with mold are highly medication sensitive. They can't tolerate standard doses or experience multiple side effects. For these individuals, acupuncture provides a non-pharmacological option that supports symptom relief without adding chemical load, and that is so important. And for those that are on medications, acupuncture can be used to support titration, which means gradually adjusting and lowering the dose while stabilizing the nervous system to prevent rebound symptoms. So why does this matter? See, mold affects liver detox pathways, which are involved in how medications are processed. The safer we can make that transition, the better. Now, one last thing to note is that these situations often end up in the medical legal setting where clarity matters. See, in the medical legal world, documentation is critical. So documentation at our center supports both the clinical and legal narrative of mold-related impairment. So if you or someone you care about is facing unexplained symptoms after mold exposure, there is hope. Biomedical acupuncture is not an alternative to medical care. It's an amplifier of healing. It bridges the gap between what patients feel and what the body needs to recover. This is what integrative care looks like, and this is what recovery can feel like for our patients.